Glaucoma is the leading cause of blindness in the world today. It affects 50 million people worldwide.
If the pressures in my eyes continued to be as high as they were, that I'd be blind by the time I was 50.
That was the highest pressure he ever seen coming through the door of his clinic.
If the pressures kept going up, the optic nerve would, at the back of the eye, would give out, and I'd probably go blind.
I just can't imagine being blind. I just find it too frightening to think about.
But these patients didn't lose their sight, thanks to a remarkable breakthrough. The new Molento 3 is built on Professor Anthony Molentino's 40 years experience in the surgical treatment of glaucoma. Incorporating his latest research, the new Molento 3 is the most advanced glaucoma drainage device available. It has increased benefits for both surgeons and patients. Under rigorous testing, Molento 3 has shown impressive results in all types of resistant glaucoma. It has the best results of any implant for most glaucomas, in some cases approaching a 100% success rate. Molento implants are the only glaucoma drainage devices with true long-term follow-up. Molento implants have been followed in vivo for 30 years. The story starts back in the 1960s when Professor Anthony Molento was a young ophthalmology registrar.
It just seemed ridiculous to me that people were still going blind from glaucoma.
He pioneered the tube and plate design that has since proven to be the most effective treatment for severe and complex cases of glaucoma.
It seemed to me that it ought to be possible to lead the aqueous from within the eye to the extraocular tissues, which normally have a low pressure.
And it would lead him to develop the first glaucoma drainage device and to do the empirical research that formed the foundation of glaucoma drainage surgery. It took time, but a successful trial in rabbits was eventually followed by a human trial.
And that was a long, drawn-out process, but it got us a long way. My colleagues and I, we were the first to publish successful treatment for neovascular glaucoma.
The early implants successfully controlled intraocular pressure in cases where medical treatment had failed, and in many cases, no additional pressure-lowering medications were required. In the early days, production of the implants was a family affair. Professor Molento made the implants at home himself with the help of his family. As more requests for the devices arrived from around the world, Molento Ophthalmic opened a purpose-built production facility where the implants are produced to the high standards required.
We check absolutely everything, nothing is left to chance. We do integrity testing and visual checks at every stage of manufacture. It's a very important bit of plastic. It's a piece of plastic that is put into somebody's body that has to stay there for the remainder of their life.
This facility now produces the new generation Molento 3 implant. The Molento 3 is easier and quicker to insert than earlier designs. The implant requires only single quadrant surgery, and each implant is suitable for either translimbal or pars plana insertion. The new flexible curved plate slips easily into place and is sutured between and slightly beneath adjacent extraocular muscles.
I use 7/0 silk because it's hairy, it holds well in very rotten tissues, and it's got a very nice needle.
In less acute cases, a vicryl tie can be used to delay drainage.
The vicryl tie has been actually our most important surgical step to avoiding post-operative complication due to excessive early drainage and providing us with a thin, permeable lead capsule.
There is no need for cytostatic agents, reducing procedure time by up to 20%.
Cytostatic agents, the mitomycin and 5-fluorouracil injected locally, do not improve the results of implants.
But after performing many hundreds of these procedures, Professor Molento still thinks technique is the most important aspect of the surgery.
Don't try and show off. The sort of cases that you are going to be working on have often had a lot of previous surgery. The tissues are a dreadful mess, and the important thing is to just take your time and go very slowly and very carefully and think.
The Molento 3 is unique amongst glaucoma drainage devices. Its design is based on 40 years of meticulous research and refinement and careful study of the physiology of bleb formation and function.
And this, I think, is the absolutely unique group of surgical operations because success depends on failing to heal.
After 3 to 5 weeks, the vicral tie dissolves and aqueous begins to drain into the primary drainage area. The primary bleb capsule acts as the flap in a biological valve, keeping the aqueous in this primary area and helping reduce hypotony. As pressure in the bleb rises, the flap lifts and the aqueous drains into the secondary drainage area, where it is absorbed into the surrounding tissues. The large secondary drainage area provides for excellent absorption and extremely effective lowering of intraocular pressure, in most cases without the need for adjuvant eye drops, reducing side effects, inconvenience and expense for the patient. As there are no moving parts, the drain will function for many years. Patients have Molento drains still functioning after more than 25 years. With such extensive follow-up, Molento drains have been more carefully studied than any other available device. They are the most effective implant for treating all types of glaucoma in the short, medium and long term.
I think Molento drains have been fantastic for patients who have been previously difficult to manage and where trabeculectomy has routinely failed.
It is so simple, it has got no tiny bits to fiddle around, so in actual fact I prefer it to any other implants.
I haven't had to turn elsewhere to find other drains because I'm very satisfied with the results I've been getting from the Molento drain.
The new Molento 3 provides better reduction of intraocular pressure with a lower risk of hypotony. It has the lowest plate profile on the market, is curved to fit the eyeball and is available in 2 plate sizes. Molento 3 requires only single quadrant surgery and is suitable for translimbal or pars planar insertion. Surgery times are reduced by up to 20%. But the last word has to come from the patients. Without drainage surgery developed by Professor Anthony Molento, they would have lost their sight many years ago.
If I didn't have that Molento drain installed, I was going to go blind.
Had it been for the operation, I would have been blind by now.
It was marvellous, really. Yes, I haven't looked back.